Hi, my name is Hemant Reddy. I'm a fellowship-trained hip and knee replacement specialist with Southern California Orthopedic Institute. Today, I'd like to talk to you about robotic knee replacement.
What is robotic assisted knee replacement and how is it different from traditional knee replacement?
Robotic knee replacement is very similar to traditional knee replacement in the terms of the implants that we're using to achieve the goals of surgery. However, the way we get to that goal can be very different. So robotic navigation is a way to guide us to the right target when we're doing the surgery. So if you could think about it as traditional knee replacement as traveling across the country by just looking at a compass and a map versus robotic knee replacement as using your GPS navigation in your phone or in your car to get to the right place at the right time.
How does the technology help you plan and perform the surgery more precisely for each patient?
Robotic technology lets us take a very personalized approach to knee replacement. What it involves is getting a CT scan of a patient's knee before the surgery is even done. It allows us to three-dimensionally model what that person's knee and their arthritis pattern looks like. Then we use that CT scan during surgery to register the knee or correlate that knee in real time to what the CT scan looked like. And then we can use that robotic technology to adjust the implants in real time so that we have the right sizing, the right position, and to make sure that we can make the knee replacement match you specifically as best as possible.
What are the potential benefits patients may experience compared to traditional techniques?
There are many advantages to robotic technology. The greatest is the benefit of precision. It allows us to be very meticulous and precise during the surgery to be able to give very reliable outcomes for patients. Additionally, the robot is very accurate, so it allows us to make minor adjustments while doing the knee replacement so that we have to do less soft tissue damage or cause less trauma during the surgery. And what that means after is it means less pain, less swelling, and hopefully a smoother recovery.
What does recovery look like? And does robotic assistance change that experience?
With the robotic knee replacement, it allows us to be more precise, cause a little bit less damage during the surgery, and it allows us to manipulate the knee replacement to match your own native anatomy. What that means is a little bit less pain, hopefully a little smoother recovery, and a knee that feels more natural than traditional techniques.
Who is a good candidate for this type of procedure? And are there cases where it may not be the best option?
Anyone who's a candidate for knee replacement is also a candidate for robotic knee replacement. Robotic knee replacement is just a tool that we as surgeons use to deliver more precise, more reliable care and outcomes for our patients. When it comes to are there people who would not benefit from robotic knee replacement, I would actually say the opposite. There are people who would have a more difficult surgery with traditional knee replacement techniques, where using robotic technology actually makes the surgery more simple, more straightforward, more reliable, and have better outcomes.
There are so many robotic platforms out there. Which one do you use and why?
That is a great question. There are many robotic platforms, and there are more coming out every day. I've had the unique experience of being able to use many of the robotic platforms that are out there, and it is my preference to use the Mako robotic platform. And the main reason for that, it is one of the few robotic platforms to incorporate the preoperative CT scan, which gives us really good in-depth information to be able to personalize the surgery and provide a very precise level of surgical experience for the patient.